know a brave group of children who have to lead a fight every day just to be themselves, of courageous and loving parents who are changing the world for their kids. And I know a group of health professionals who listen and believe in their patients, no matter how different from them. As a pediatrician, my mission is to improve the lives of every single child. We are trained to be professional, ethical, and knowledgeable. But my young patients and their parents have given me the most important gift, an understanding of how to make meaningful change. Being a physician should not just be about diagnosing and treating a disease, for example. If an injustice has been done, we should not stay on the sidelines. We have tremendous power to advocate for our patients and make change. We owe it to them who put their trust in us. Here is how my patients and their families taught me this life-changing lesson. This is a photo of my patient Tyler with his mother. Tyler was assigned female at birth, but at age 2, he started saying he was a boy. At age 7, he became depressed and started having suicidal thoughts. His parents took him to multiple psychologists and psychiatrists, and he was diagnosed with gender dysphoria, the distress that a person can have if the gender assigned at birth does not match one's gender identity or inner sense of one's gender. Psychotherapy did not seem to help Tyler, and his parents made a terrifying and difficult decision on their own. In their words, they finally listened to him and allowed him to live as a boy. They cut his hair, bought him stereotypical male clothing, and started using a new name, Tyler. To everyone's great relief, Tyler's depression improved significantly, and for the first time, he was happy. But this would not last forever. At age 9, the physical changes of puberty started to appear, and Tyler became depressed again. They tried to find a medical provider that would stop the changes of puberty. But what they encountered were physicians unwilling to even see him, or who simply said that they could not help. They scheduled an appointment with me. I'm a pediatrician who specializes in endocrinology. That means that I can give a treatment to stop puberty in children who start too early. Someone in my clinic heard the reason Tyler was coming to my clinic, and they asked me, "You're not going to see this patient, are you?" That surprised me. Maybe it shouldn't have. I live in Dallas, Texas, a traditional region of the United States. My response was, I will see him, I will listen to this family, and think about a way to help them. There was one encounter in my past that helped me listen to this family. It's one of those events in your life that is simply eye-opening. Many years before, Dr. Norman Speck, a pediatric endocrinologist and the first one to start a clinic for transgender youth in the US, introduced me to a transgender person for the first time in my life. I have to admit that before then, I had a completely erroneous belief about transgender people, simply derived from ignorance and upbringing. I often say that if you don't understand what it is to be transgender or why they're fighting for their rights, just meet a transgender person and listen to their story. It only takes a little bit of humanity to understand. What struck me from this first encounter was how genuine this person was about his gender identity. Growing up in a very conservative environment, he had to advocate for himself against all odds. And it would be hard to assume that his gender identity could be the result of parenting or social influence. Actually, there is no data to support that nurture and that nature can cause somebody to be transgender. And attempts to change one's gender identity through psychological therapy are not only ineffective, they're actually harmful and considered unethical by the mental health academic societies in North America. On the other hand, there is new data to suggest a neurobiological cost to a transgender identity. There are parts of the brain that are sexually dimorphic, in other words, that tend to be different in males and females. In transgender individuals, brain imaging studies have shown that those parts of the brain tend to be more consistent with the gender they identify with, and not so much with the gender assigned based on the genitalia or the chromosomes or even hormone levels. After I met Tyler and his parents, I told them that I had no experience providing puberty suppression for gender dysphoria, and offered to refer them to doctors back in Boston who had more experience. But they couldn't afford to travel back and forth. And they said, "We don't care if you experiment with our child. We will do anything for his mental health." Why would a parent go through so much to support their child's gender identity? In their words, because they prefer to have a living son than a dead daughter. The parents of my patients will tell you that having a transgender child is not something they wished for, because it is indeed a difficult road to walk for them and for their kids. Do you know how many transgender youth attempt suicide? 41%. That's almost half of them. Why? At least in part because they're frequently discriminated against, bullied, isolated. My patient Tyler told me he felt like a ghost at school. Having romantic relationships, going to college, finding a job, many things that many people take for granted, can seem very difficult or impossible for transgender youth. Matthew is a 10-year-old transgender male, assigned female at birth, but with a male gender identity, and supported by his parents to live as a boy. Matthew can't sleep because he's afraid of a legislation that will not allow transgender individuals to use the restroom consistent with their gender identity. If he's forced to use the female restroom, isn't he going to be questioned by the girls at his school because he looks like a boy? Are they even going to let him in? Bethany is a sweet and innocent 9-year-old transgender girl, assigned male at birth and now fully living as a girl. She knows that if she uses the male restroom, she can be bullied or physically assaulted. She asked me one day, "Dr. Lopez, why can't I use the girls' restroom at school?" It broke my heart that I didn't have a reasonable answer for her. I have patients that do not use the restroom at all at school, just so they don't have to be questioned by peers or staff. Some develop urinary infections, constipation, and dehydration because they're avoiding drinking water in order to not use the restroom. Some people are concerned that if transgender individuals use the restroom consistent with their gender identity, then other males might want to enter female restrooms for inappropriate reasons. But aren't those already crimes? And this doesn't seem to be an issue in schools and parts of the world where transgender individuals are allowed to use the restroom consistent with their gender identity. Is this enough to deny a basic right and discriminate against children? Now imagine that you're discriminated against at school and also not supported by your family. Then the risk of suicide attempt increases to 60%. And what happens when transgender adolescents are accepted in their identity by their parents? The risk of suicide attempt decreases to 4%. Parental support is critical. After I met Tyler, I went to the mental health team in my hospital asking for help. To my surprise, the only experience they had with transgender children came from admissions to the psychiatric unit for suicide attempts. Let me say that again. The only experience the mental health team had came from admissions to the psychiatric unit for suicide attempts. That is too late. The need to intervene early was obvious. And I was incredibly fortunate to find an amazing and passionate staff at my hospital who became as inspired by Tyler and other patients as I was. And despite not having much experience with transgender children, they understood the need and were ready to start helping these kids. We built a multidisciplinary center that provides not only mental health support, but also medical intervention to provide relief during puberty. Why puberty? If you're transgender, puberty means that it will become harder, sometimes impossible, to look like and be seen as the gender you know yourself to be. Some people ask me, wouldn't the hormones of puberty help align one's gender identity with the gender assigned at birth? In other words, in accordance with one's genitalia or chromosomes? But we see the contrary. The gender dysphoria or the distress becomes stronger with puberty, and the risk for depression and suicide increases. So the question is, do you conform the identity to the physical appearance, or do you conform the physical appearance to the identity? The humane answer is to conform the physical appearance to the identity. That is the answer that makes patients happy. That is the answer that saves their lives. Cami, a trans girl, started having nightmares when she turned 12. She was terrified about developing an Adam's apple and facial hair. Puberty suppression provided great relief by preventing those unwanted sexual characteristics, which are also permanent. As a pediatric endocrinologist, I provide hormone therapy to induce puberty in non-transgender children who, for medical reasons, are unable to produce the hormones of puberty. Those non-transgender children want to develop like their peers. They don't want to be different. Well, the desire of transgender children to start their puberty that corresponds to their inner gender is simply heartbreaking. Just imagine that this treatment will induce the physical changes that, for the first time in their lives, will allow them to present to the world as who they really are. This 3-step protocol is called the Dutch protocol, as it was first developed in the Netherlands. The first step is to prevent the unwanted puberty around the time of onset of puberty. The second step is to induce the wanted puberty around age 16. And the third step is to have genital affirming surgery as an adult. A long-term study that followed patients treated with this protocol from adolescence into adulthood showed improved mental health outcomes, resolution of the gender dysphoria, and their quality of life was similar or better than the average population. None of these patients regretted the treatment. This was a major breakthrough, as for the first time, there was evidence of the benefits on the support of one's gender identity through physical intervention before adulthood. Now, is it ethical to provide hormone therapy that will permanently affect minors? Providing this therapy to minors is ethical. It is ethical because failure to provide treatment will cause harm, and we know unwanted puberty does cause harm. It is ethical if the caregivers and the medical providers believe the young patient is more likely to benefit from treatment rather than regret the consequences at a later date. Many of our patients' families are very religious and socially traditional, and they support their child's gender identity. They make very difficult medical decisions and advocate for them in the community. Why do they do that? Because, like any parent, they want their child to be happy. And that's what we as physicians want too. I have found that training for a career or having a job does not by itself give you a purpose in life. What adds meaning to your life is knowing that you're actually helping someone who deeply needs it. We physicians continue to learn through our patients. I have learned that treating people for who they are and not what they are can mean the difference between life and death. Thank you.